Welcome to another episode of Single Payer Radio. We broadcast our program from the historic Habron Building in downtown Louisville. This show is a project of Kentuckians for Single Payer Healthcare, and we are an affiliate of the Kentucky chapter of Physicians for a National Health Program. We have this program because we believe healthcare is a human right. We advocate for a national single payer we advocate for a national not-for-profit single-payer healthcare system, everybody in, nobody out. The views and opinions expressed on our show are those of the speakers and not the station. I'm Mark McKinley, a volunteer with the group. Single Payer Radio can be heard on WFMP 106.5 on Mondays at 2 p.m., Tuesdays at 7 a.m., and Wednesdays at 11 a.m. If you can't pick up our signal, you can live stream us at forwardradio.org. If you miss a show or want to listen again, you can go to the archives at forwardradio.org. WFMP is an all-volunteer station. We rely on the community for your ideas and our funding. Join us. Just before we get going here, I want to ask listeners to save the date. Join us to celebrate Medicare's 58th birthday with the documentary, The Power to Heal. It's a free admission. It's Sunday, July the 30th at 2 p.m. It will be shown at the main branch Louisville Free Public Library at 3rd and York. Please join us. This documentary is based on David Barton Smith's amazing book, The Power to Heal: Civil Rights, Medicare, and the Struggle to Transform America's Healthcare System. And speaking of amazing, here's Kay Tillow, Chair of Kentuckians for Single Payer Healthcare. Kay will lead the discussion with our very special guest. Kay?
Thank you so much, Mark. And I'm just really delighted to have with us today for this discussion the prominent writer and inspiration for our program, David Barton Smith. He is a research professor in health management policy. His PhD is in medical care organization from the University of Michigan. He is professor emeritus at Temple University and adjunct professor in the Department of Health Policy and Management in the School of Public Health at Drexel University. And there's much more, but I won't take the whole program with that. He's the author of 7 books, including The Power to Heal, which is the one on which the documentary is based. And we are going to be discussing that content today. He is the authority on the implementation of the Medicare program and its impact on desegregating the nation's hospitals. So welcome, David. We're so happy to have you with us.
Thank you so much. It's a privilege to spend time with both of you.
Could you describe for us the situation in the United States hospitals in regard to segregation in the period prior to the passage of Medicare in 1965?
Sure. Hospitals in this country were the most racially segregated institutions in our society, publicly accessible institutions in our society. Within a matter of 6 months, that changed as a result of the Medicare program. and they became perhaps the most integrated public service institutions in the nation. And that was a reflection of some rather magnificent work that was done by civil rights activists in terms of basically taking over the enforcement of the Civil Rights Act, which said that no federal dollars should ever go to an institution that discriminated on the basis of race, in making it a reality in terms of the Medicare program. So it was an exciting thing to write about. And it was also exciting because it was whether deliberately or not, a story that got covered up. And nobody, even healthcare policy experts in this country, were really aware of what actually happened and how it happened.
Well, we're eager to learn all about how it did happen. And I must admit, I wasn't aware of it. And I had worked in the civil rights movement in the South and had left there before '66, but I was not aware of this story until I heard it from Quentin Young and from the Physicians for a National Health Program. In your book, you state that Black health professionals supplied much of the backbone for the civil rights rebellion in the US. Could you explain what you meant by that?
Sure. As you know, one of the best ways, at least in the Jim Crow South, for preserving those institutions was the economic threat that anybody that favored desegregation faced. Black physicians were basically the backbone because they served the Black community. And even if they were not that big on civil rights, they were basically told by their patients, you can advocate for us because we protect you. We pay your fees, and you need to serve as an advocate for us. Along with many of them that were more than willing to pick up that cause, what you will discover is that many of the cases related to desegregation of schools, other civil rights cases have physicians as plaintiffs. And even more prominent were the dentists in the country, because they were pretty much independent practitioners. They were not quite as reliant as Black doctors on assistance from white physicians had privileges at hospitals. So they were much more free in economically independent to serve in that function. So what you discover on local NAACP chapters throughout the South, that the bulk of the people on the board of these organizations were dentists, physicians, and to a certain extent ministers as well.
Mm-hmm. What was the Mississippi Sovereignty Commission and what was its strategy?
Well, the Mississippi Sovereignty Commission was served as a model for a number of other states. to intimidate people involved in bringing desegregation cases or trying to actively organize protests. And they it was placed in the governor's office. It was well financed. It hired former FBI agents as investigators. It kept tabs on the whole movement, and indeed even infiltrated it with people that would serve as their spies. So it was, it was kind of the closest thing that we've come to Nazi Germany in terms of the kind of police state control it imposed on people organizing for civil rights.
Mm-hmm. It was not just the South where the hospitals were segregated. Could you tell us what was the situation in Chicago in the early 60s?
Sure, at Chicago and quite a number of other cities, segregation was much more sort of under quieter and undercover. There was sort of an understanding that medical staff privileges would be allocated on the basis of race, so that only the public hospitals and the historically Black ones had physicians that served the Black population on their medical staffs. So even though there was no laws, Jim Crow laws, prohibiting it, a combination of geographic segregation, residential segregation, and payment created almost as equal amount of segregated medical care as existed in the South.
Mm-hmm.
It was a national problem.
Yes. How did it happen that the Medicare legislation was passed in 1965?
Well, that's kind of an interesting story because the only real advocates, medical advocates for the Medicare program was members of the National Medical Association, the Black Medical Association, that were doctors in most regions of the country were excluded from the American Medical Association local chapters because of race. And they were very supportive. In fact, when the bill was finally signed by Lyndon Johnson at the Harry Truman Library, they were the only medical group that was invited were members and representatives of the leadership of that National Medical Association, because they were the only ones that were really advocating for the Medicare program. And despite a lot of pressure that was placed on them by the American Medical Association, who thought that, they were physicians and they should be united in opposing the Medicare program.
How did the Medicare legislation relate to the Civil Rights Act of 1964?
Well, all the people that supported the Civil Rights Act, all the groups supported, including the American Nursing Association, were supported Medicare. So it was kind of there was an overlapping kind of in supporting both of those efforts. Medical professionals that were in support of civil rights were also in support of the passage of a universal health insurance program for seniors that was passed with the Medicare Act.
David, let me ask you, I never realized the sequencing of how Johnson passed the Civil Rights Act with Title VI in it, and how that opened the door to some of the other areas within legislation, and he could use Title VI for Medicare and other acts.
Well, it's fascinating because either he was much more of a genius than I ever thought he was, or it just happened by accident. If the Medicare bill had been passed before the Civil Rights Act, I don't think there would have been a Title VI in it, because at that time everybody just yawned, at least in medical communities, because there really wasn't a really national presence in terms of public dollars going to hospitals, to medical schools, yes, but not to most hospitals. And so it wasn't that important. Suddenly, with the passage of Medicare and in combination Medicaid, they now kind of 40 to 50% of all the dollars that hospitals were going to receive. So suddenly it became a powerful stick. You could either sign your contract and become a Medicare provider, or you could go bankrupt. That was basically the choice. And that's basically the choice of any universal health insurance program. If it's universal, nobody can escape from it. And the basic argument always said, oh, well, we'll do it in our own good time, and it's really more important that it be a voluntary effort to desegregate. Well, what they discovered is that when a few courageous hospitals did desegregate, they lost all their white patients. And some of them, including a key one that's involved in my a new book, almost went bankrupt because they chose to go against the tide, because the doctors just sent their patients to their white patients to the other hospitals. Now with a universal program, you say we're not going to discriminate on the basis of race. Hospitals had no choice.
David, can you talk a little bit about what life was like for persons of color when they got sick, and as far as distances maybe they had to travel to get their care, or what happened in that situation?
Well, first, let me say that there were some remarkable improvements in outcomes for Blacks. We talk about health disparities, but some dramatic changes took place as a result of the Medicare program, where suddenly Blacks had equal access to all hospitals. Whereas before, in many communities, there was only a white-only hospital, and they would have to travel long distances, to get one that would accept Black patients, or they were stuck in a basement annex, separate, and that basically communicated to them that they were getting second-class care.
You speak in your book about you draw a contrast with what happened after the Brown versus Board of Education decision that said separate wasn't equal, but we didn't automatically get integrated schools. That continued to be segregated in our society. And yet in Medicare, there was a dramatic change that integrated the hospitals, and that's really an amazing inspiration. Can you tell us why it was different with Medicare?
Sure. Obviously, everybody would supposed to desegregate in the school systems, but with all deliberate speed, whatever that means. And with the Medicare program, we were presented with a quite different choice. You were free to choose as a hospital to be a Medicare provider. You didn't have to be a Medicare provider, but if you chose, you had to sign a contract that basically said, you know, we don't, our hospital doesn't discriminate, and we don't do this because we don't treat any patient differently on the basis of race, in terms of which rooms they go to, in terms of what doctors they see, in terms of other things. So suddenly, yes, this was a financial contract. And basically, the position of the Medicare program and HEW at that time was that you don't have to sign this contract. We will only, but if you do, these are the conditions that we expect from you. And this is the law of the land, because Title VI of the Civil Rights Act that was passed just a year before Medicare was passed said you cannot discriminate on the basis of race and receive federal dollars.
Can you tell us, where did the staff come from that would work to enforce civil rights law in Medicare?
Oh, this is kind of a fascinating irony. Obviously the Southern legislatures that controlled the appropriations committees in the Senate and the House were predominantly Southerners that believed in Jim Crow, and basically what they did is they provided no money for enforcement. So we had an office in HEW with a staff of 4 people that was responsible for desegregating 6,000 hospitals in 3 months. Okay, with a staff of 6, no budget for travel, no budget for even clerical staff. Okay. So what John Gardner did, the only Republican member of Lyndon Johnson's cabinet, is basically send a memo out to all the major parts of HEW and says, you know, civil rights is now a cause that we are responsible for enforcing, It is urgent that it be done appropriately, and we will accept volunteers from your branch to be shifted, and you will have to be responsible for paying them their salaries and their travel expenses, but they will be transferred to this voluntary effort to enforce the Civil Rights Act with the implementation of the Medicare program. Well, the magic of this was not only did they get more than enough volunteers to do this, is that they were very committed civil rights activists and very bright people and very committed and willing to be chased by Klan and have crosses burned on their lawns and all the things that most people would rather, the image of bureaucrats that like to go home at 5 o'clock to have their cocktails did not apply to these people. They worked 80 hours a week during this period, doing what was necessary and being very creative about it in terms of making it work. But the real reason it worked were because of the Black healthcare workers that were in all of these hospitals that were basically the eyes and ears of the civil rights movement. And they would just call and say, hey, you got to come back. They're doing it again. They're resegregating the bassinets in the maternity floor, and they're doing this and that. You come back and do your inspection again. And there's no way the hospitals could hide. And so finally people figured out that the only way that they could survive financially, even the rock-ribbed, hard-nosed financial business types understood that their hospital was going to go bankrupt if they didn't comply with these sort of the certification for compliance with the Civil Rights Act. So the whole deck of cards collapsed, and all the defenses left. And not only did they end up doing a rather magnificent job of desegregating these institutions, they even did it secretly. The hospitals did not report to their communities the fact that they were desegregating. They just did it and pretended that it had always been desegregated.
Yeah. David, can you speak to, and you have a little bit, but some of the entrenched white supremacist folks in towns that were listening in on phone conversations and the dangers. I know you speak about, was it a doctor, a woman who, a compliance person who went south, and it's just so tragic.
Yeah. Well, I mean, they did a pretty good job of protecting most of the investigators. The people that were in the most serious trouble, of course, were people that were actually worked and at these hospitals and were the whistleblowers, including the Blacks that faced, at the very least, firing for calling the civil rights enforcement group and letting them know what was going on. And of course, in my next book, I talk about a very courageous young physician who was a member of the medical staff of a hospital that had developed a plan for avoiding segregation, that became the whistleblower and the mole inside the hospital that helped commit them to try to do their best job at trying to prevent this. The plan that they had, the medical staff had, to avoid real integration of the hospital. So yeah, it was it had all the scary issues of other types of civil rights stuff. Only it was a much more. They didn't make headlines.
Well, it's interesting that synergy between the federal government and civil rights activists on the ground, ordinary folks like hospital workers who were in the cafeteria and who were cleaning the floors, were key figures in the ability to make this happen. And
Absolutely, they were the really courageous ones, and they were the heart and soul of the movement. And what happened the civil rights movement, I mean, we talk about regulatory capture. And usually when we talk about regulatory capture, we talk about the drug companies capturing the regulation of drugs, the hospitals capturing the regulation of the financing and payment. But in this case, this was a civil rights movement that basically captured the regulation of the hospitals in terms of the Civil Rights Act, and basically wrote the regulations and participated in the training of the inspectors, the Medical Committee for Human Rights, the Legal Defense Fund, the SNCC Corps. They were the ones that were doing the training for these federal bureaucrats to go down to these inspections, and they wrote the regulations. They wrote the process. So it was kind of an amazing time, and one I think that can be recaptured again with a universal health payment system.
can you tell us how you see that it could that could happen?
Well, that we've got we almost have organized medicine on our side now. I'm sure when it gets down to the nitty gritty, there's going to be some differences, but everybody recognizes the craziness of the system that we have created. Basically, what we've done is perpetuate a Jim Crow healthcare system. Through the nature of payment, the privatization of payment, through the various ways that we have ennobled what is called freedom of choice, which was the ultimate defense of Southerners who wanted to support Jim Crow in hospitals. Was it, oh, we'll let anybody into any unit they want, but we give people freedom of choice, and nobody in their right mind would choose to go into a historically white unit as a Black patient. with that kind of would make that kind of choice. So the trick, of course, was that it has to be everybody's got to be in the same boat. We are all citizens. We have to be treated equally, and this is the law of the land. And if you don't want to do that, you don't have to participate in this program. If you, as a patient, don't want to go to a racially integrated facility, then you're free to pay for wherever you want to go, where you can get that care from a facility that does not provide services to the Medicare patients. It said, basically said, for the first time in this country, we're all in this together.
In the book, you tell the story of the Louisiana hospitals that were making progress in integration, but that a check showed that the Red Cross kept the blood segregated in Louisiana. And somehow this crew of enforcers was able to change that. Could you tell us how that happened?
Well, that's kind of a fun story, because I got to interview the person that actually desegregated the blood supply in Louisiana. And basically what it was he didn't check with the lawyers. He called up the president of the Louisiana Hospital Association, and he said, none of your hospitals in Louisiana will be eligible to participate in the Medicare program unless the blood supply is desegregated. And it was kind of a risky thing, because I guess this guy could have called the president of the hospital association could have called up his senator or congressman and said, who's this person in the bureaucracy telling us to segregate our blood supplies? But basically what happened is the entire blood supply got desegregated in less than 24 hours. Because the president of the Louisiana Hospital Association called up the president of the Louisiana Red Cross and said, you're screwing us. And we need those Medicare dollars, and you better desegregate that blood supply immediately, or we'll find another supplier.
I love that story. How
magically, all the blood supply was integrated. There are all kinds of stories like that.
Oh, well, we love to hear them. In the context of this struggle, what did it mean when the people spoke about the golden rule?
Yes, right. Well, everybody talks about the golden rule in healthcare, and basically the golden rule in this case, and it should be the case in any program that is supported by federal tax dollars. It should be, is that we have the gold, we rule. And if you want our Medicare dollars, you have to do what we say. And what we want is full integration of your facility. No distinctions on the basis of race in terms of anything, including, the rather insulting habit of calling blacks in the South by their first name and the whites in the facility by Mr. and Mrs. and all that kind of stuff. Basically, the rule was you got to call it. You got to use the same names for everybody. If you're using first names for one group, you have to use first names. For the other group, or you have to call everybody Mr. and Mrs. And that was very easy to enforce because, of course, there were always Black healthcare workers in these facilities that could basically blow the whistle. So the golden rule. And yeah, it would be nice to have that golden rule now, because unfortunately what's happened with both the Medicare and the Medicaid program is become predominantly privatized, and you've lost that lever that you used to have with the universal program.
Right, it's a huge problem. About over 50% of Medicare recipients are now in Medicare Advantage, which is the private companies. And then in addition, there are people who chose traditional Medicare who have been automatically placed into these experimental programs where the same kind of thing happens with private equity and venture capital. And the body that's supposed to oversee and make things just is the CMS, the Center for Medicare and Medicaid Services. And I'm afraid that in many ways it has been captured by the industry that wants to function to make profit out of our healthcare system.
Yes, and basically turn us back into a Jim Crow system. Because unfortunately, if you provide what's called freedom of choice, people are going to make choices of plan based on what they can afford to pay. And if one program offers additional services without without a co-payment, then that's going to attract a low-income, impoverished group into that program, and you're going to create a very separate and unequal system of care in terms of hospital care and in terms of medical services. And tragically, that's what we see happening.
You know, we've often been told that for those who don't want to see change come too quickly, that you just have to work on education and let it slowly evolve over time. And I think it was the civil rights movement that challenged that as a path to justice. And the amazing thing about this Medicare story is the speed with which the desegregation, with which decades of discrimination were wiped away, and the hospitals were actually nationally integrated. I think that the bill was passed in July 30 of 1965, and I think they had a date for implementation of Medicare was to be July 1 of 66. And so it's only about 11 months. How in the world did they do this within that period of time?
Well, that's the magic of the golden rule. Yes. And furthermore, you know, the federal government had never done this before. They'd never put their foot down in the way they did with the Medicare program, thanks to the civil rights activists that basically infiltrated the whole regulatory process. And the lesson they got from that was, wow, we can do this in other areas as well. And one of the first areas was in terms of higher education. And they basically said in the 1972 Higher Education Act, no university, no college will get any federal funding if they discriminate in their programs on the basis of sex. And suddenly, magically, medical schools became almost overnight, almost as fast as the hospitals had been on race, almost as fast in recruiting females to their medical schools, to their law schools, and to their business schools, and to other programs that had been basically sexually segregated. And of course, they all were very proud about being pioneers in terms of doing it. But the bottom line is everybody looked at where the dollars were coming from in terms of supporting these programs, and particularly for medical schools and allied health programs and other programs in universities. There are a lot of federal dollars, and they moved very quickly. And so that barrier to access to professional careers disappeared almost as fast as the barrier to access to hospitals.
Yeah, David, in your book, you talk about the results of the '64 election, where Democrats held a 2-to-1 margin in the House and a 32-seat majority in the Senate. And then the U.S. Supreme Court expedited some decisions in favor of civil rights. And I just think where we could be now had Lyndon Johnson not gotten involved in the Vietnam War, that peeled off so much support and gave life to Nixon and beyond.
Yes, it's we always can think, oh, what would have happened if this hadn't happened, or that hasn't happened, or if Kennedy hadn't been assassinated, or whatever it is. But you roll with the punches, and you keep moving. I mean, civil rights movement didn't start in the 20th century. It started in the 19th. Mm-hmm. And they've won some battles and they've lost a lot, but maybe finally we're beginning to come together in terms of this. And I think healthcare is really a symbol of whether we're all in it together or whether we're not. If we're just going to be a bunch of feuding jerks, then we get what we deserve. But I think we're coming together eventually on this, and I think probably one of the easiest things to come together in is the right to health care.
Mm-hmm.
We've got about 10 minutes.
It's interesting that even the most backward segregationists of the South wanted to keep their health care, didn't want their hospitals to close, wanted that health care to be there. And so when it came to a question of whether they would integrate the hospitals or close them down, they chose for health care. I think maybe we're in that kind of situation now, where our healthcare system is being shut down by the profit within it, and the co-payments are so high. I just saw that a majority of people are impacted by the inability to pay for their health care and go without or delay because they cannot afford it, in spite of the Affordable Care Act.
Right.
So this is real inspiration about what was done around Medicare in that period of time.
Well, Donald Trump, forgive me if I mention his name, has been told by his constituents, don't let the government mess with my Medicare. And I mean, there is remarkable unity in terms of support for that program. And everybody understands that that is something that is important to preserve and to expand. One of the things about the problem with the system we have now is that it costs twice as much money as countries that have healthcare is that it is segregated. We have a separate system for low income and most minorities, and we have another system for the more privileged and affluent. And we could probably save half the expenses and do as well as these other developed countries do with their systems, just by unifying it, having a single, as you say, single payer system.
We are trying to bring those issues together because we always celebrate Medicare's birthday here. We've done it in the past. One year, we got up on the bridge over by the Ohio River with lighted signs that said, expand Medicare to everyone and pass HR 676, which was kind of an amazing thing. Over 15,000 people, we were lighting up the night sky. And we're doing that again. We've delivered cupcakes to Congress people, even to Rand Paul and to Senator McConnell. We've given them cupcakes for Medicare's birthday. And this year we're going to show that film, The Power to Heal. It's going to be at 2 p.m. on July 30. That's a Sunday afternoon at the Louisville Free Public Library, 301 York. And it is free, and we invite everyone to come, and we will lay out the plan to move from the Power to Heal in Medicare to a plan for universal, not-for-profit, improved Medicare for all, and a way to try to get there. So we are just delighted that you were able to join us for this discussion, and that you have done so much to enlighten the public about this story, which is a hidden part of our history and a good piece of the history. There's so much bad in our history. This is one of the good things that we did between our federal government and our activists within our communities. And we are very grateful that you have brought this story to light and are sharing it around the world. Is there time for him to tell us about his new book, Mark?
Most definitely, yes.
Well, I first want to make sure to encourage everybody to see the documentary. Danny Glover does a great job being the narrator, and he's very impassioned. There are some amazing and humorous stories in that documentary that illustrate the point. It's amazing to see so many of the people that were such courageous heroes in that effort that are now have now left us, that are in that document. So this is an important piece of our history that is terribly important, that we don't lose and forget. And I hope everybody that possibly can, no matter what their politics, and certainly the movie documentary has gotten a number of prizes, get a chance to view it. My own story is one related to what I believe was the murder of a young physician in a hospital in the South, that was one of the whistleblowers in an effort to prevent the medical staff of a historically white hospital, white-only hospital, from getting their medical staff to admit only their white patients, continue to admit only their white patients to the hospital. And that would have been an effective threat to this effort to desegregate the institutions. She died on her front steps after her identity was inadvertently revealed, with a 48 bullet in her chest. It was ruled an accident 2 days later, and appears to have been covered up. The Emmett Till Cold Case Act that was passed by Congress to look into all of the mysterious deaths that took place, racially motivated mysterious deaths that took place in South, have taken on her case, and it is now being investigated by the FBI and the Department of Justice. So she was a white female physician, and she deserves to be recognized for her courage and her commitment to equal healthcare and to her role as a civil rights activist. She actually did desegregate the hospital that she was the chairman of the medical staff for, but that and that almost caused that hospital to go bankrupt because it happened before the implementation of Medicare, and she wanted to make sure that revolution was not blocked. So it's a story of her case and a story of all the related arguments that have been made about preserving the existing system against a publicly governmentally run insurance system. And I think it's pretty powerful, and I'm excited
Great.
that it will be out in October.
David, we're out of time now, but thank you so much for joining us today on the show. It's so insightful. Your book is The Power to Heal, Civil Rights, Medicare, and the Struggle to Transform Americans' Healthcare System. Thank you so much.
Right. Thank you so much. It's been a privilege to have a discussion with you guys, and good luck with all your efforts to push this movement forward.